Understanding the silent threat. Hepatitis D. Hepatitis D, often called Hep D, is a liver infection many people don't know much about. Unlike the more commonly known hepatitis A, B, and C, this form needs a partner in crime, the hepatitis B virus, to do its damage. That's because Hep D can only infect people who already have hepatitis B. Once it gains a foothold, it can trigger a range of issues, from mild liver inflammation to severe liver scarring, known as cirrhosis, and even liver cancer. The tricky thing about Hep D is that it often flies under the radar. Many people don't experience any noticeable symptoms, especially in the early stages. This silent progression makes early detection a real challenge, but a critical one. Catching it early gives us the best chance to manage the infection and prevent serious complications down the road. So, how do we catch a silent threat? That's where the detective work begins. Diagnosing hepatitis D is a multifaceted process that involves a series of tests designed to unravel the mysteries within our bodies. These tests are like pieces of a puzzle, each providing a crucial clue to help us understand the extent of the infection and guide treatment decisions. Let's delve into the world of medical investigation and explore the key steps in diagnosing hepatitis D.
Unmasking the virus. Serological tests. Our first line of defense in identifying hepatitis D involves a bit of blood work, specifically serological tests. These tests are designed to detect telltale signs of the virus in our blood. Imagine our immune system as a vigilant guard dog. When it encounters an intruder like the hepatitis D virus, it releases specialized proteins called antibodies to neutralize the threat. Serological tests act like detectives, searching for these specific antibodies in our blood. If found, they serve as a red flag, indicating that our body has encountered the Hep D virus. These tests are relatively simple to perform, typically requiring a routine blood draw. The results help us determine if we've been infected and if our body is actively fighting the virus. There are different types of antibodies, each telling a different part of the story. For example, the presence of IgM antibodies often suggests a recent infection, while IgG antibodies indicate a past or chronic infection. Deeper dive. Molecular tests and liver function. While serological tests provide valuable clues about our immune response, molecular tests take us a step further by detecting the genetic material, RNA, of the hepatitis D virus itself. These tests are incredibly sensitive, allowing us to identify even the slightest traces of the virus in our blood. Think of molecular tests as high-powered microscopes, capable of spotting the virus's genetic fingerprint. They help us confirm the diagnosis, determine if the virus is actively replicating, meaning it's making copies of itself, and even assess the effectiveness of antiviral treatments.
Alongside molecular tests, liver function tests, or LFTs, provide insights into the health of our liver. The liver is like the body's diligent housekeeper, responsible for filtering toxins, producing bile for digestion, and synthesizing essential proteins. When the liver is inflamed or damaged, it releases enzymes into the bloodstream, which LFTs can detect. Elevated liver enzymes such as AST, aspartate aminotransferase, and ALT, alanine aminotransferase, can indicate liver injury caused by the hepatitis D virus. Monitoring these levels helps us gauge the severity of the infection and track the liver's response to treatment.
Blood clues, complete blood count, and coagulation. Our blood holds a wealth of information, and a complete blood count, or CBC, provides a comprehensive snapshot of our overall health. In the context of hepatitis D, a CBC can reveal any abnormalities in our blood cell counts, which can be affected by the virus or by complications related to liver damage. For instance, a low platelet count, known as thrombocytopenia, can be a sign of advanced liver disease. Platelets are tiny blood cells that play a crucial role in clotting, and a decrease in their number can increase the risk of bleeding. Speaking of clotting, The liver is responsible for producing most of the proteins involved in this intricate process. Coagulation tests, such as prothrombin time, PT, and International Normalized Ratio, INR, assess how well our blood clots. Liver damage can impair clotting factor production, leading to prolonged clotting times and an increased risk of bleeding complications.
Section 5. Visualizing the liver imaging studies. While blood tests provide valuable information about the virus and its impact on our liver, imaging studies allow us to visualize the organ itself. Ultrasound, Connecticut scans, and MRI scans are like X-rays for our liver, providing detailed images that help doctors assess its size, shape, and any structural abnormalities. Ultrasound, a non-invasive technique that uses sound waves to create images, can detect signs of liver inflammation, fatty liver disease, a common condition in people with chronic hepatitis D, and cirrhosis. CT scans and MRI scans provide even more detailed images, allowing for the detection of liver tumors, blockages in blood vessels, and other complications. These imaging studies are particularly helpful in monitoring the progression of liver disease and guiding treatment decisions. For example, if imaging reveals signs of advanced cirrhosis or liver cancer, a liver transplant may be considered.
Section 6. The gold standard liver biopsy. While all the tests we've discussed so far provide valuable pieces of the puzzle, the gold standard for diagnosing hepatitis D and assessing the extent of liver damage remains the liver biopsy. This procedure involves obtaining a small sample of liver tissue, which is then examined under a microscope by a pathologist. Think of a liver biopsy as a magnifying glass for our liver, allowing doctors to see the microscopic details of the organ's cells. The biopsy can reveal the degree of liver inflammation, the presence of fibrosis, scarring, and the stage of cirrhosis, if present. Although it sounds intimidating, a liver biopsy is a relatively safe procedure typically performed under local anesthesia. The information obtained from the biopsy helps doctors determine the best course of treatment and provides a baseline for monitoring the effectiveness of therapy over time.
Section 7. Fueling recovery, dietary tips, and the power of fruits. While medical interventions play a vital role in managing hepatitis D, adopting a healthy lifestyle, particularly through our diet, can significantly impact our liver's well-being and overall recovery. Our liver, like a diligent worker, needs the right fuel to function optimally. A balanced diet, rich in fruits, vegetables, and whole grains, provides essential nutrients while minimizing strain on this vital organ. Fruits, in particular, deserve a special mention. Packed with vitamins, minerals, and antioxidants, they offer a plethora of benefits for our liver health. Berries, for instance, are abundant in antioxidants like anthocyanins, known for their ability to protect liver cells from damage. Citrus fruits, such as oranges and grapefruits, are rich in vitamin C, a potent antioxidant that boosts the immune system and supports liver detoxification. Incorporating a variety of fruits into our daily diet can be as simple as enjoying a fruit salad for breakfast, adding berries to yogurt, or snacking on a piece of fruit between meals.
Section 8. Navigating life with hepatitis D. Receiving a diagnosis of hepatitis D can be overwhelming, but it's crucial to remember that it's not a life sentence. With proper medical care, lifestyle modifications, and a positive outlook, individuals with hepatitis D can lead full and healthy lives. Regular monitoring, adherence to prescribed medications, and open communication with healthcare providers are essential for managing the condition effectively. Support groups and online communities can provide invaluable emotional support and practical advice from others who understand the challenges of living with hepatitis D. Remember, knowledge is power. By understanding the virus, seeking timely medical attention, and making informed lifestyle choices, we can navigate the path of hepatitis D with confidence and resilience.